talking more about it, particularly from the legislative angle, as the COVID-19 has thrown a great challenge at not just Nigeria alone, but the globe, the whole world as it is, particularly in the health sector. So my guest in the studio this morning is no other person but Honorable Amos Magaji. He's a member, House of Representatives, and of course a member of the House Committee on Health. And we're going to be looking further at today's topic, revitalizing the healthcare sector, particularly in this very trying time. Good morning, sir, and thank you for coming through.
Good morning. Thank you for having me.
I'm sure you heard the banter between my colleagues there in Lagos, and what they're saying perhaps is not far from the truth. However, let's look at COVID-19. I'm sure the House has been on recess, and you probably have gone back home to your constituency to be in touch with your people. But the question I'm going to ask here is this. Looking at how the Nigerian government has handled the whole issue or the challenge of COVID-19 from last year up until this time, would you say that it's a function of how well they have done, or is it down to mere luck, given that we're not posting the sort of numbers we're seeing in other countries?
Thank you very much. I would say, in respect to COVID-19, I would sincerely thank the wonderful team and all the good work they did in trying to arrest the situation. Regarding the number of cases that have been recorded, basically, I think we have less cases because of lack of testing. I think recently they have actually increased the number of testing per day. If you look at other developed countries, and so the number of people they actually test per day, is by far compared to what we test in a month or in a week. So the more you test, there is the likelihood that you record more cases. So the truth about it is that when you look at also our, medically it has been said, because of the region we find ourselves, that initially it was said that dead bodies will be littered all over Nigeria. But then if you look at it, if we are not testing, and we are not seeing dead bodies everywhere, so that means even the strain of the virus that is around here, probably with the tropical diseases that we've been having, perhaps God has just used that one to to scale the effect down of the virus. Because of a truth, I know that the access to health, the access to testing is not as good compared to other parts of the world. But yet, we are not recording death like other parts of the world. So something must be working for us, and which I believe probably the resistance or probably some of the diseases that we have suffered before, it has also maybe built an antibody against the COVID. I don't know. Maybe research needs to be done to find out.
It's understandable, given the fact that you're not a medical expert, but is it not, for one watching, one would express some sort of concern that why would we have as a country largely, because if you just mentioned the fact that it probably is an act of God, so divinity, that we are not posting very high numbers, particularly mortality rates and all of that. But must we always get to that point of having that sort of conversation rather than shoring up our healthcare facilities so that a situation like this can be, scientifically confronted?
Donna, I am from the medical background.
Okay.
Good. And I will tell you what we did as the Committee of Health Institutions. Immediately the lockdown was lifted, the cuff was lifted, we went to almost all the federal health institutions in the country. And it will shock you the level of dilapidation that we saw in many of the health. Because this thing took everybody, even developed countries, unaware.
Okay, Honorable,
yeah.
Please hold that thought. We'll go on a quick commercial break, and when we come back, the conversation will continue. Stay with us. All right, welcome back. And just before that break, I was having a conversation here with Honorable Amos Magaji, and he was raising an important observation, given the fact that before, just immediately after, at the start of the COVID-19, at the height of it all, they had the privilege of traveling around Nigeria to visit health facilities. So, sir, I would like you to pick it up from there.
Yeah, thank you. We had the opportunity or the privilege of traveling all over the nation. We visited all the federal tertiary institutions, and what we saw was alarming. And why we decided to do that was because it was almost time for we wanted to have a clear understanding of the position of our health institutions before the budget it's presented to the National Assembly. That will guide us in knowing where and how to adequately or properly channel the resources so as to arrest some of the situations that we saw. And it was a good outing, and we were amazed to see the level of decay, and then the effort that the medical personnel have to go through, in arresting some of our health challenges with the little resources and with the little facilities.
But some will argue that it is not new. I mean, we've seen a series of strikes by medical practitioners in the country over time, calling the attention of government to this issue. But why did we have to wait until such a pandemic before going all out and appreciating the level of decay, as you put it?
Yeah, you see, I will say here that when you look at the health sector, there needs to be a deliberate and political will in handling some of the challenges that we have. Maslow hierarchy of needs, you discover that health is one of the most important. There's a scripture in the Bible that says a man will give everything to the exchange of his soul. You have to be well first to go to work. You have to be well first to aspire to do anything on earth. So health is number one. And but I think we have relegated the issue of health to the background, and that's why, because we didn't have a health policy that we are really following to advancing or equipping or building our health facility. So when this thing came, then there was no a program that we're actually following to revamping our health sector. So whether you like it or not, times like this will actually expose your lack of preparedness, will expose your inadequacy, will expose the degree of training and preparation you have. And the COVID exposed so many things. And I remember is it the secretary to the federal government, who is the leader of the COVID delegation, said that he didn't know that is how the state of our health sector, having gone through, and he saw some of them, he was lamenting. So it's because of negligence for over the years. So if we have a program and we are following it very well, we'll discover that we are not where we're supposed to be, but we have a policy we are following, so that in 2028, where do we see ourselves? In 2030, where will Nigeria be? When we have it and we are deliberately executing it, following it, we will live where we are today. But no matter the program you have, no matter the policy you have, policy is one thing, implementing it is another thing. So no matter the policy you have in health and other sector, once it is not being followed, it's not being implemented, you will have this problem.
But some would say that if you're talking about policy implementation, you basically have the function of oversight. Even as a member of the Health Committee of the House, you have an oversight function. So why should we cry so much about, following through on some of these policies?
We have oversight as the legislator, but the whole buck rests on the executive in the implementation of every policy. We go for oversight, but I want you to understand that the resources for oversight is also not there enough for us to carry out the oversight that we are supposed to carry out. You discover that some institutions, you may just go there, okay, maybe once or twice in a year. It's not enough. It's not enough. And when you go, there are places that you should spend. For example, now a team goes to a youth, or let's say University of Abuja Teaching Hospital. It's not a visit that you should spend one day. It's not a visit that you should spend 2 days or so. Sometimes if you really want to see, you need to sit down, you need to go through over and over again. So imagine how many health institutions we have, and then knowing that the number of people in the committee. We're barely about maybe 40 or so in the health institutions committee. So even if the committee is divided into let's say you pair us into two and you send per state. For example, 2 are sent to Kaduna State now. You have health institutions like the Ahmadu Bello Teaching Hospital. You have health institutions that like neuropsychiatric hospital. You have the eye center. You have the air center. You have many of these health institutions. So you have to look at their books. You have to look at their project. You have to look at their budget implementation. It's a whole lot. And of course, I tell you that the resources that the National Assembly has to implementing her program is not even enough.
Okay.
Secondly,
we'll have to leave. We'll come back to the issue of funding. But then another critical issue which has been thrown up. But personally, I actually had an experience. A friend of mine recently just left the country to join her husband in England. In other words, for medical practitioners, COVID-19 threw open an opportunity for some of these persons who may have wanted to leave the shores of Nigeria to travel out. And that is what a lot of people have expressed concerns. I mean, the brain drain as well. So what, as legislators, what are you doing or what will you be doing deliberately to ensure that this is curtailed to the barest minimum? Because in the end, if we provide all of the facilities, all of the funds, we still need the manpower to handle the health sector.
Yeah, I would say number one problem in health institutions is human resources. That's the number one problem that we have in health institutions. I have classmates that never even practice. Some of them left for, you spend, when we're in Zaria, I spent over about 10 years in Zaria. And I had classmates that spent 12, 13, 14. By the time you finish medical school like that, sometimes you get tired. And all you want to do is to make money and take care of your family. And so any job that is paying well. And at the time we were finishing, then all these NGO started springing up very well. Yeah. And many people decided to go into public health and left clinical practice. So you discover that also, even though they're in public health, it has left vacuum in clinical practice. Yeah. I'm not saying public health is actually very good because the preventive, it takes almost care of every part of the medical practice. Then you now have the problem of also those that are actually practicing, the clinicians. You now discover that the remuneration is very poor, and then the attraction is there all over. It's not only medical doctors. You have nurses that have become hotcakes all over the world. So it even started before the COVID. People were leaving, but then the level of departure got so high when different countries were trying to get help from different neighboring countries also, and then that opens the window for many people to travel out of the country. It has left. I was talking to one of the medical directors of one of the federal medical centers, and he said in a week, 7 consultants left his hospital. In a week, about 10 nurses, qualified nurses, left. I mean, specialized nurses.
And that's disturbing.
Very, very disturbing. He was worried. He was worried. One, how will he replace? Human beings are not like machines part. If one part is broken or destroyed, you just procure the same part and you fix it and the machine begins to work. But people come to work with their experience, they come to work with their exposure, they come to work with their temperament. So even if you have a very wonderful staff that is working and then suddenly leaves, even if you bring somebody with the same qualification, may not be able to deliver the same like the person that left. So it became a very huge burden on medical directors and CMDs all over the country. If you meet any CMD right now or medical director of a tertiary institution, one of the things they will tell you about is the problem they are having with human capacity. So that's one critical angle that we need to look at.
So, having said that, I want to tie these two questions because we'll come back to wrap it all up. But I need to tie these two questions in one. Primary healthcare delivery is a very critical aspect of healthcare delivery in Nigeria, and we have a situation where state governments and local governments are expected to also participate, particularly in the funding. Now, we also are looking at the issue of funding generally. We can say that there was an increase from the budgetary allocation for 2021 as compared to what we had in 2020. But how do we see all of this playing out, particularly in revitalizing the health sector in 2021 and beyond?
Yes, there was increase. When you look at the books, you say, yes, the budget was increased. There's increase in the budget. But sincerely, I will tell you, it's not even enough. The budget for health this year was the budget for health 2021 is about 547 billion.
That was after the House increased.
Yes. 547 billion. Now look at 547 billion, divide it by 200 million Nigerians. That means each Niger per head we have 2,700 for the whole year. Like as I'm sitting here right now, the budget for health on my head is 2,700. As against the budget for health in America. This year, the budget of health in America is $4.8 trillion. And America has a population of 331 million. If you divide it, each American is having per head is about $12,000. If you convert it to Naira, each American is having about 5.4 million Naira per head compared to 2,700 per head. The American budget this year for health was about 17.7%. Nigerian budget
struggling with the 15%.
Yes,
we're still struggling with that.
No, we're still struggling with the 15% of Health Policy Act of 2014 and the Abuja Declaration of 2001, which say 15%. The budget for health this year was about 4.8% or thereabout. 4.8% of the total budget. 4.8% went to health. So look at it. Like for you now, we seated here, me and you have less than 5,000 for the whole year. And as we are talking about primary health care needs to be revamped. That is the way forward for our health system. Because you see, you go to tertiary health institutions and people are going there for malaria. So it's actually distracting and also increasing the burden that tertiary health care are having. But once we develop our primary secondary health care, that they begin to handle disease, and then they are closer to the people. That will begin to solve some of the problems that we have. Now, I made mention of human development, human capital in health. I made mention of the poor funding. The next, I think, major aspect of problem in healthcare delivery in Nigeria is the infrastructure. Yeah. Sometimes they are not enough. Where you find them, they are not well equipped. Or sometimes, even when they are you hardly find a well-equipped hospital that can handle some of the the problems we're having. Not to talk of the health insurance. How many Nigerians are registered or have been enrolled in the health insurance? So these are some of the major problems we have. Honestly, we are far from where we expect or we're supposed to be regarding our health system in Nigeria. The health management information system is very poor. Numeration is also very, very poor. When we're in university, when they say you're a medical student, you are carrying yourself like this, you're a medical doctor, a medical student. But by the time you finish and you're practicing, and with all the wahala, the reading, the time you put in, and you see yourself, you have to be humbled. And that's the reason why you are having that brain drain.
Honorable, I'm going to ask a rather pedestrian question, because oftentimes when you go on the streets, people will always re-echo this. In the midst of all of this, people often say, we still have lawmakers who take home jumbo pay in the midst of the pandemic and all of that. So how are you going to address that, as a house, to be seen as responsive to what is happening in Nigeria? I know you also complained about funding, particularly when it comes to your oversight functions and all of that. But in an average Nigerian will still ask the question, your jumbo pay, and then with all of these problems, what is the house doing in this regard?
Can I tell you the truth? People have overrated all this issue of jumbo pay. I wish it were true. I wish it were true that we are collecting 25 million. I wish it were true that we are collecting 19 million. I wish it were true that we are collecting 10 million. I wish it were true.
So what is the truth?
The truth is that my salary for the month is less than 1 million. Other packages are running costs. The running cost is the same with every a director in the Ministry of PAMSEC. Now, when he comes, he tells you that his salary is 400,000, 500,000 or so. But in his office, he has running costs, which is not part of the salary, which he has to retire. So other amount that people are talking about are running costs for the member, for your traveling, for maintaining your constituency office, and nobody gives you, in my office right now, nobody gives me anything to run my office. I came here now, I fuel my car to come here. I go to my constituency. I just came back yesterday. I fuel my car to go. I have staff I pay in the constituency. I have only 5 staff that the National Assembly gave me. But I'm telling you, I have more than 20, 30 people in my payroll that I pay down in the constituency. And I wish the health system will work well. I wish the educational system will work well. I wish the infrastructure will work well, so that nobody calls an honorable member or a senator and asks him for medical bill. With the meager salary and all part of this, we still pay. Somebody will go to give birth, you will pay. They will call you that my wife is in the hospital and then she has given birth and right now want to leave, and they say we have 30,000 to pay. And I can sincerely tell you that the request I will receive today, if I have 5 to 10 million naira on my table, it will finish just today. And if I will record them, I will see you later in the evening and tell you that these are the requests I have gotten. From house rent, to school fees, to hospital bills, so many things. It's overwhelming, honestly. And if you don't have a heart for people, you will be broken. Sincerely. So people don't understand. And people say you go with Jumbo Pay. Listen to me, sir. I think my balance in my account was more than what I have right now before I joined the house. Yeah, before I joined the house, I have 20 million. If I have 50 million, it stays there until what I want to do with it, I do. And if I give somebody 2,000 naira at home, they'll almost do Hail Mary for me. But right now, if I give 20,000, they will say, this is what you are giving me.
All right, by way of wrapping up and very quickly, what are your final thoughts? Because at the end of the day, regardless of what is said, we still want a health system that works and is responsive to COVID-19 and other health challenges moving forward. What is your final take on
My final take on this is for the government to really look at how to revamp our economy. Because I also understand that the budgetary allocation for health is low because of the economy, because of the finance. We are far. Even the budget for defense. The budget for defense, the budget for New York Fire Department, New York Fire Department is almost the budget of the country. So we are far. By the time our economy picks up and we are doing very well, I believe that all these sectors, the education, the health sector, will receive a great boost of our budget. So I think the prosperity of the nation, number one, and then when that is done, I think proper allocation will be made to health sector and different sector of the economy.
All right. So, thank you very much, Honorable Amos Magaji. We thank you so much for coming through on very short notice, as a matter of fact.
Thank you very much.
Appreciate that. So, Lagos, Show, and Agoho, thank you. You've heard it all on this end, and we can only hope that something is done drastically to address the shortfalls we have so that health will be made available for all Nigerians at all levels. Back to you.